When a life-changing diagnosis happens, it hits you like a boulder. It hits you like a massive rock. It immediately sends you in a state of panic. Yet, you feel like you're routinely felt with this vacuum and felt with this feeling that you don't have a roadmap. To be honest, this can happen even before cancer diagnosis. But with the diagnosis of cancer, or with that word, cancer, the C word, it really sends someone into a panic. But let's talk about first as a problem, then I'll give you some solutions for it. When we talk about prior to cancer diagnosis, how many of us are aware and follow through on topics like screening for cancer? There are many cancers that can be screened early, can be detected early, so you have a better chance of cure. How many times we miss some simple lifestyle changes that can help to reduce the chances of cancer in your lifetime? We spend significant amount of energy and time on some trivial things in our life. Let's say you're buying a car. How much research you do before you buy a car? How many people you talk to before you buy a car? How much of reviews you read before you buy the car and before you get a loan on the car? Why don't we do that when it comes to our own health? Why? We tend to be a lot more reactive than proactive when it comes to our health. But the way the cancer works is it doesn't happen instantly. Meaning, if someone smokes, the cancer is not going to happen in the next month or 6 months or a year. It happens 10 years, 15, 20, 30 years later. Meaning, cancer changes, or the changes that lead to the cancer in the body, happens over many years. That means what you do today matters what happens to you 20 years later or 30 years later. Now, once you think about this, you will start to know what exactly the solutions look like for this. Let's talk about solutions. The first and foremost solution I'm going to cover in two brackets: prior to cancer diagnosis and during cancer diagnosis. Prior to cancer diagnosis, the key is try your best to be aware and spread that awareness. For example, as simple as mammogram, colonoscopy, pap smear, CT scan for lung cancer screening. These are just real simple things. But how do we get to that solution? It goes back to my statement as always: have a primary care physician and have an annual visit every single year with your family physician or a primary care physician. I go back to this again and again and again. I know it can get boring, but it is a small investment you can do for your health that will reap you benefits for the rest of your life. Have a primary care doctor. During cancer diagnosis, some of the, when you're bombarded with the cancer diagnosis, there is enough research to show that you absorb only 2% of the information. 98% of the information is lost. That is what I call information vacuum. And that's what leads to uncertainty, scary, anxiety, lack of sleep, and it's just fearfulness. But how do we overcome that? Take a family member with you, family members with you if you have multiple family members. Ask the doctor if you can record the conversation. Most doctors will not say no. Some might say no, but respect their decision on that. But make notes. Take a book and a paper and a pen with you. Ask for any paperwork that might give you questions, that might give you information in a paper format. Prepare questions ahead of time. Write them down on a piece of paper. Preferably have a book for your diagnosis and for the future. In my opinion, always get a second opinion. It never hurts to get a second opinion. As a doctor, I always encourage my patients to seek a second opinion. There's nothing wrong with that. I don't feel egoistic about it. If someone tells me that this is not the way I would treat it in a different way, I embrace that so we can give the best to you. And every visit, prepare questions, have a book, write down your symptoms, and ideally, you should have what I call a clinical navigator, someone like a GPS, think of an Apple map or a Google map, to tell you what that roadmap looks like if you need to go from point A to point B. So, let me summarize again. Information vacuum, meaning you are in this hole that you have no idea what's happening. That can happen before diagnosis and after cancer diagnosis. Before diagnosis, the solution is have a primary care doctor. Be aware, educate yourself, and follow through. After cancer diagnosis, have a support system. Family, friends, don't be afraid. Have a journal of how you're feeling, to the questions you want to ask, and have a summary of your diagnosis and all the details about your cancer. Have a navigator, someone like a GPS. And last but not the least, get a second opinion at different points of your diagnosis. You will thank me later on this one. If you have any further topics or you want to share your story, please DM us here. We would love to hear from you. Thank you again for your attention. This is your OncoCare advisor and Dr. Raghav here.